Welcome to another episode of the Med Madness podcast, where we dive deep into the world of medicine and unravel complex topics to help you master the essentials. Today, we'll be discussing a particularly significant type of ovarian tumor known as the granulosa cell tumor. This is a malignant tumor with a unique ability to produce hormones, and understanding its pathogenesis and clinical presentation is crucial, especially for those in the field of gynecology and oncology. We'll also walk through a real-life case study to see how these tumors present in clinical practice. Next, let's discuss the pathogenesis of granulosa cell tumors. Granulosa cells play a critical role in the production of estrogen. They convert testosterone into estradiol, a potent form of estrogen, through the action of the enzyme aromatase. In a granulosa cell tumor, there is uncontrolled proliferation of these cells, leading to an overproduction of estradiol. Additionally, these tumors secrete inhibin, a hormone that typically inhibits follicle-stimulating hormone, or FSH. The excess estradiol and inhibin levels are key to the pathogenesis of granulosa cell tumors, and they drive many of the clinical features we observe. Now let's move on to the clinical features of granulosa cell tumors. These tumors can present at any age, but they are most commonly diagnosed in postmenopausal women. The clinical manifestations of these tumors can be divided into two categories based on the patient's age: the juvenile subtype and the adult subtype. In the juvenile subtype, which typically presents in younger girls, these tumors can cause precocious puberty due to the elevated levels of estradiol. In the adult subtype, these tumors present more commonly in adults with symptoms such as breast tenderness, abnormal uterine bleeding, or postmenopausal bleeding resulting from unopposed estrogen exposure. This unopposed estrogen leads to endometrial hyperplasia or even endometrial cancer. Additionally, a palpable ovarian mass may be noted during physical examination, which often prompts further investigation. Next, let's talk about the histopathology of granulosa cell tumors. One of the hallmark features you'll see under the microscope is the presence of Call-Exner bodies. These are small eosinophilic structures that resemble rosettes, and they are a key diagnostic clue for pathologists. Now let's discuss the management of granulosa cell tumors. Management typically involves surgical removal of the tumor, followed by careful staging. Given the association of these tumors with endometrial hyperplasia or cancer, an endometrial biopsy is often performed before surgery to assess the extent of the disease. After surgery, inhibin levels can be monitored to check for recurrence. To bring it all together, let's consider a real-life case study. A 62-year-old woman presented with postmenopausal bleeding. She had been in good health until she noticed a few episodes of vaginal bleeding, which prompted her to visit her gynecologist. On examination, a complex ovarian mass was detected. Laboratory tests revealed elevated levels of estradiol and inhibin, raising suspicion for a granulosa cell tumor. An endometrial biopsy confirmed the presence of endometrial hyperplasia. She underwent surgery to remove the tumor, and her post-operative course was uneventful. Her inhibin levels were monitored post-operatively to ensure no recurrence of the tumor. To summarize, granulosa cell tumors are a rare but important type of ovarian tumor with significant implications due to their hormone-secreting capabilities. Key clinical signs include postmenopausal bleeding, a complex ovarian mass, and symptoms related to excess estrogen, such as breast tenderness. Remember, early detection and proper management are crucial to prevent complications like endometrial cancer. As you reflect on this topic, don't forget to engage with our pre- and post-podcast quizzes and check out the Anki flashcards we've prepared to help reinforce your learning. Thanks for tuning in to Med Madness. Until next time, keep learning and stay curious.